So, disclosure, like I stated earlier, I work for Healthmark, and that all opinions in this presentation are mine. And yeah, Healthmark's policy and philosophy. Healthmark really strives to help educate the industry, and we want everybody to be well informed and aware. All right, so let's get into it. Our objectives. So our objectives for this presentation are going to be as follows. So first, we are going to review common misconceptions regarding peel pouches. We're going to discuss proper care and handling of peel pouches. We're going to review the do's and don'ts regarding the use of peel pouches and describe quality aspects pertaining to peel pouches. A lot of peel pouches. All right, so let's start at the very beginning. Yep. When I say very beginning, I mean very beginning. We're going back to the molecular structure level. Yay. So we want to talk about your packaging and how it's created. And this is important. We'll talk about this later, why this is really important, but we just need to understand that our packaging is made out of what's referred to in the industry, the packaging industry, as PET, polyethylene, I can't say this word, terephthalate, terephthalate material, right? And so it really refer to this whole chain as a polymer chain for medical packaging, right? And so we'll be talking about polymer chains a little bit more going forward, but just so you guys know, when we talk about polymer chains, this is kind of what we're talking about. And then we talk about how our packages are created. We need to talk about what's called webs. So we have, when we're creating a peel pouch, there's two different webs that get placed into a machine. And so the webs are basically the rolls of material, right? So you've got, like, for instance, your top web. So in the picture we see it's a clear plastic. And then we got our bottom web, which is, this case, it's a Tyvek material, or it could be your paper, medical grade paper material. And these two webs are placed into the machine, and then the machine takes it through and then cuts out the pouches and then does the whole process for sealing them and stuff like that. So when we're referring to pouches and we're talking about the different aspects of the pouch, if we say the word web, this is really what we're referring to, the two different layers of it, two different materials that are put in. So when we look at our pouches, we have different aspects to each pouch, right? And so they can vary. We're just really looking at our self-seal pouch right here. So we have heat-sealed pouches as well, and somewhat have similar aspects to them, but some are different. And so right now, what we're looking at is called a chevron peel pouch. And so in the packaging industry, we just say peel pouch and everybody's like, oh yeah, that's a peel pouch. But there's different names, right? So there's a chevron peel pouch, there's a corner peel pouch, there's header bags, there's so many different names that, oh, I'm learning so much as I go along with packaging, right? But it's cool. So we're learning different aspects and different words that are used. And so here we're looking at a chevron pouch because the top has this kind of chevron concept that it goes up at the top. And that's really an aspect to help us open the pouch more easily. And then we have our light green see-through like film. So we tend to refer to this as our plastic side of our pouch, right? And so that plastic allows us to see through it and identify any damage or issues as well. We have our perforated folds, which actually help us to do the process of sealing the pouch correctly when we have a self-seal, and we'll talk about that. We got our wide seal strips at the bottom with the adhesive already built in. Medical grade paper on the back of this one, or we would have something like a Tyvek material on the back. and that's a plastic, right? And then your manufacturer's seal that you see going around your pouch, and that really helps form the structure of the pouch and gives you the confines of how far or how much like you can go out with an instrument and so forth. So when we're talking about sterilization pouches, they have to have four primary objectives, right? And so they must allow for the penetration of the sterilant. So whether that's steam, EO, hydrogen peroxide, whatever your sterilant is, that pouch has to be designed to allow for that sterilant to get inside. They must be able to maintain the sterility of the package until it's open. Must create a package that can be opened without contaminating, right? So basically your aseptic presentation. So are you able to open this in the operating room and do it in a aseptic way that keeps its sterility? And they must permit the contents to be sterile at the point of use. So when I grab that item, it's still sterile. And then pouches should also be tamper evident so that the pouch opened in air cannot be resealed. So once you open a pouch, that's it. You can't put it back together, right? You can't like, oh, okay, let me just reuse this. So we're going to talk about shelf life, right? And so this is kind of in the very beginning because this is part of the whole process for validation for pouches, right? And so this is something that really gets confusing for some people, right? So a lot of times we go into facilities and we ask, what is your policy on shelf life? Well, it's event related. That's what we hear. That's great. However, event-related sterility can also be include time. Time can be an event, right? So most manufacturers, when they, well, all manufacturers, when they manufacture a pouch, they have to do a shelf after sterilization shelf life, right? And so making sure that it stays sterile for extended period of times. Now, some manufacturers choose to do 6 months, some do 1 year, and others go up to 5 years. But that means that if your facility is paying attention to they're doing event related, they really have to consider that time frame that that validation study, that extended life validation study was done for, right? So this is different, right? This is different from shelf life of unprocessed pouch. So if I have a box of pouches that I haven't sterilized yet, there's an expiration date on those, right? There's a shelf life for those. If I have, that's different versus once after I sterilize it. So you can see, for instance, in this picture was taken in August of 2022, and the package was actually sterilized in May of 2019. The problem is this manufacturer in particular, they only had a shelf life study done for 6 months. So that naturally means that the facility would strongly consider breaking down everything after 6 months and reprocessing it. So really encourage you guys to pay attention to your manufacturer's sterilization shelf life validation and really know what that time frame is. So there's some misconceptions out there, and so I kind of brought this to the beginning too because I wanted to throw these out there and we can talk further about them, but where does this come from, right? So many times there's so many different misconceptions I hear about pouches, but these are about the top four that I hear a lot. So pouches are tested to absorb impact from 6 feet or less dropped, right? So I hear that, right? Well, I dropped it, but I only dropped it from my waist, so it should be good. It doesn't work like that. And so where this misconception really comes from is that manufacturers for packaging, they do validation for shipping and drop um, like shipping cartons dropped, not individual pouches, not individual boxes of pouches, the overall shipping system, they do a test on that. So basically that big cardboard box that everything comes in, that's what they're doing a drop test on. So if something drops on the floor, you really want to get a new one. Pouches are tested for manufacturers to be carried in your pocket. No, no, they don't. And actually, they were very surprised that we do that. So, not a practice that they recommend, and should not be done. A pouch is good forever as long as you have no holes, right? And so we just kind of talked about one scenario, right? That time situation would be a major area where that this is not so much the case. So making sure that you're taking all aspects into consideration when we're talking about sterility of our pouches. And then pouches are made of any size. I'm sorry, pouches are made for any size item as long as it fits, right? So the old, hey, if it fits, it ships. No, that doesn't work here, right? So we can't just take something and then shove it inside a pouch just because we can get it in there. There's different parameters and different rules that have to be followed when we're talking about this. So let's talk about assembly. So we want to protect your instruments, right? So we want to utilize tip protectors to help ensure that our delicate instruments are protected. We want to make sure that also the pouches are protected, and we'll kind of go over that, right? And so there's a lot of different options out there for to be used on instruments. So you got to make sure you're choosing the correct option that works the best for the product that you're using and also for the mode of sterilization that you're doing, right? Because not everyone is compatible with every modality of sterilization. And we all know or have had the OR complain about skin hooks with the tip protectors, those plastic tip protectors, trying to get those off. And or if you're a scrub and you try to get I've been there, done that, right? It's not fun. And it's dangerous. So just making sure you have the most adequate tip protector to help you with what you're trying to accomplish. So for instance, this is one of the card tip protectors that are that is out in the market. And so this one has a nice window for you to see the tip of the instrument. It actually is raised up a little bit. So like curved instruments fit in this one a little bit better. And it's a nice handle, like when you're trying to get it out from the package, right? You just come in, you grab a little hole there, and then you're able to pull it right out of the pouch. It's got like a nice little finger ring there. So when we're talking about tip protectors, AORN actually has some guidelines and recommendations, right? They say when used, tip protectors should be validated for the sterilization method. We talked about that, right? And then also tip protectors should be colored or tinted, not clear. And the reason that they say this is because sometimes it's very difficult if that falls into a patient. How do you know that fell into a patient? Or tip protectors should be radio pegged somehow. So making sure that you're following those guidelines as well. So now we're going to talk about our seal, right? And so when we're talking about the seal, we want to make sure that when we're talking about self-seal pouches that we're doing that seal correctly. We kind of were going over a little bit about the importance of a seal, right? And so an uneven, wrinkled seal, so you can see on the very far left that the seal did not go flat and even. It's actually overhanging on one side, and we're going to talk about why that is. And then we got loops, right? So it's not that great to see, but you can see there's like a loop at the bottom. So that means that your pouch is still open. It's really not completely sealed. And so is it really acting as a barrier for microorganisms? We have gaps in the seal. You can see kind of more towards the left here. There's like a big square gap in the whole seal. It didn't actually seal correctly. And then you have uneven creases in the seal. Like, so you got these wrinkles and creases going through your seal. Those are just channels for those little microorganisms to be like, oh, yay, thank you so much, and run into the package. So really want to make sure that you have a nice flat even seal regardless of what type of pouch that you're using. So when we talk about self seal, it's all in the technique. It's all how you do it, right? So when we were going over the basically pointing out the parts of the pouch, we talked about a perforated fold. And so that perforated fold should be, the process should happen is you take the fold, you fold up, you crease on that perforation, then you peel away the paper, and then you start in the middle of the pout of the seal with your two thumbs and you work your way outwards to the edge. If you do it this way, you're going to have a nice flat, even seal. We all kind of get in that habit of, we're in a rush, we rip the protective strip off, the sticky, then we fold it up and then we try and seal it, and that's when we get it going off to the side, or we get a nice bubble and it doesn't work correctly. So following the right technique makes all the difference. So we talked about, we have two different types of sealers. We have our continuous feed heat sealer, and then we also have our bar heat sealer. The continuous feed, just like it says, continuously feeds it straight across the front, and seals the pouch. The bar heat sealer requires you to manually flip the bar, put the pouch in, flip it up, and then once it's done, it will drop. One of the biggest things that I see all the time when I go into facilities is that there's a Teflon roll inside this bar sealer, and people are not rotating it, right? Like departments, they're not doing the rotation of it. There's a little knob on the side. You guys can see it onto the left side of this sealer. And that knob needs to be rotated so that Teflon tip gets rotated. Otherwise, you start getting buildup, and that buildup starts creating blackness on your pouches or does not give you an even seal. Quality testing. So when we talk about peel pouches, no different from anything else, and your heat sealers and stuff, you have to do quality testing on them. It is a piece of equipment that you use daily. And so you really want to do a test on these every day that it's in use. So there's multiple different types of tests and ways to test this, but what you see in the blue here, this is a ink dye test, and basically you just create a seal, put your pouch, your little ink pack inside, you break it open, you seal it, sorry, you seal the other end, break it open, and then you can see if you have any breaks in your seal. And you can see in that blue one, we did have a break, right? You see it dripping down out of the bottom because it wasn't completely sealed. And then we have the orange one, and that is made for your Tyvek pouches, your plastic pouches that go into hydrogen peroxide and stuff. Same concept. You can also grab your, to make sure you're getting a nice even seal, you should take a piece of pouch or a test product and stick it inside your heat sealer and test it to see how it did. You can see in this one, we had a nice big gap in our pouch, in our seal. And for good measure, we got a nice little bug out of it too. It fell out of the heat sealer when we went to seal. So just making sure you're checking these pieces of equipment is crucial. Additionally, you don't want to be doing these things, right? So taping, taking tape, steam tape, or whatever hydrogen V-Pro tape or whatever it is, and utilizing tape to create a seal on a pouch is not allowed, right? You need to use your heat sealer, or it needs to be a self seal. So the tape does not create that seal that is needed to keep microorganisms out and create that barrier for sterility. So the other thing you can't use is paper clips, staples, and binder clips, stuff like that. I feel like everybody's probably laughing at this point and going, "Who does that?" But you would be surprised. There are places out there who people get desperate in desperate times and they try anything. But those things are not allowed. And then also rubber bands. So rubber bands are not allowed around peel pouches. So not around sterile peel pouches. And I strongly recommend don't put them even around not sterile peel pouches. Because rubber bands, two things. One, you got to worry about latex. And if they are latex free, the other major thing is we just talked about polymer chains in our pouches. Putting bands around them starts breaking down those polymer chains and the integrity of that pouch. So no rubber bands. So then we're talking about labeling, right? So when we talk about labeling content and making sure that we label properly, we want to make sure we're labeling in the correct spot. You want to check your IFUs for the right labeling location. So mostly we do not write on anywhere on the paper or the white plastic. It's always on the clear see-through plastic side of the pouch. If we're writing, we use a non-toxic Sharpie marker or non-toxic marker. Nothing that's going to poke through or damage the integrity of the pouch, like a ballpoint pen. um, However, there are some manufacturers out there who have now validated that the fold, that seal, strip seal at the bottom, for their pouches, you can write on it. So that's the reason we say, please make sure you're checking your IFUs to ensure that those pouches are validated for that. And there's really only one out there that I know of. So please make sure you're checking. And then you have to label, right? Like, so we can't just sterilize something in a pouch and say, oh, we can see what it is. That's not what Amy says. Amy actually states that you actually have to label the contents of your pouch. And also you have to have the initials of the person who did it, the description, the date, cycle number, and your sterilizer and so forth. So we're seeing double, right? Double pouching. Some facilities don't allow it and some facilities do. And so when we're talking about double pouching, there are some key aspects that we need to pay attention to. One of them being that if your pouches do have those arrows in them, on them, really want to make sure that those arrows are facing in the same direction. This is to help with the opening, and when you peel those pouches, remember we got those two the web layers. When we peel those two apart, we don't want to have any fibers, right? And so when we have the arrows, it helps us determine what's the best route to peel, like what's the best direction. So we want to make sure that the arrows are facing in the same direction so that the OR opens in that direction. Your inner pouch is not sealed, right? So we can see in this, we got a nice Gelpy sitting inside an inner pouch. And I get it. You know, somebody put that in there to try and act as a tip protector, but that is not what the standards say, right? When you double pouch, the inner pouch needs to be sealed. So you need to make sure you're sealing the inner pouch. And then we have two different manufacturers. So you can see we got a green color and a blue color here. Not always the case with the color situation, but sometimes. So you really need to make sure you're paying attention to your pouches, right? You cannot use two different manufacturers for sterilizing an item, right? I mean, no company is going to validate somebody else's pouch with theirs, right? They're not going to be like, hey, hey, McDonald's, can I borrow your French fries? I want to put it with my hamburger and see how it goes. They're not going to do that, right? So please keep that in mind. Do not use two different manufacturers. They have to be the same manufacturer. So skinny pouches, right? This is a new in style look. Skinny pouches. No, it's not, guys. They're not skinny jeans. So the rule of thumb, remember we talked about that the manufacturer creates that seal on the pouch themselves. This is help give us guidelines on where our instruments should be. And the rule of thumb is usually about 1.5 inches to 2 inches from the edge of your pouch, right? So meaning your instrument should have a space of from all sides of at least 1.5 inches to 2 inches. And your package, so like if your packaging is tight like this, what winds up happening is when it goes into the sterilizer, it expands and contracts, right? And so as it does that, you're already putting a lot of stress on those manufactured seals. And those seals can start breaking and getting micro holes in them and not be able to keep the sterility barrier that it needs to. So there's Conan and his skinny jeans for you. So just a quick video to talk so you can see what happens in the pouch and with the pouch and the sterilizer. Okay, sorry guys, I didn't realize how loud that was. Well, so it looks like it's gonna blow, right? So kind of like the popcorn, the old Jif popcorn thing pans that used to put on the stove. And if you guys don't know what this is, that means I'm just really old. But yes, so back in the days, that's what they used to do with popcorn. And so it used to expand just like you see in that picture, and kind of reminds me of what happens to the pouch inside the sterilizer. So that will blow up and then it'll fall down and then blow up again and fall down. So just keep that in mind when you are putting items inside pouches. All right. So what goes on the outside cannot go in. So meaning things like your peel pouches are considered an outside containment device, right? Same as your wraps, same as your rigid containers. And so I cannot put a wrap inside a rigid container. Same thing, I cannot take a peel pouch and put it inside a wrap tray or a rigid container. We see this often. People use pouches as dividers instead of using bags or the rolls or something towards that effect. They use pouches as dividers. And you can see in this picture here, we've got a nice sterilite piece of wrap and filters. Wrapped around a glass syringe to try and protect it. Great thought process, but can't use that inside a peel pouch. It's not validated to do that. So you got to know when to fold them. And in this case, that means never. Do not fold, period. So when we're talking about folding peel pouches being folded to fit inside another peel pouch should never happen. Also, in addition to that, folding a peel pouch to fit into a sterile storage bin or onto a shelf is also something that should not happen. Once again, we're going to say this again about the polymer chains on this, right? So you start folding this, we start getting creases, which means we're breaking down those chains, and we start making these pouches susceptible to micro holes that maybe you can see it, maybe you can't, but let's not risk it. And so it makes it susceptible, and now we compromise the sterility barrier of these items. So when we talk about pouches, one of the key things you need to remember is to know your material, right? So we want to make sure that we know what our sterilization material, what our pouch material is in comparison to what type of sterilization we're doing, right? So because if we take this pouch, which was a Tyvek pouch, and we put it into steam, which that's what we did, not intentionally, but mind you, it happened. So it got put into steam, and you can see it kind of did that little, like, what do they call it? A shrink-a-dink concept, right? So it just like completely sealed around the item and the instrument. And so this is really hard sometimes to get off the instrument, depending on the actual instrument that it was in the pouch. So making sure you know, like, okay, Tyvek is plastic material. I cannot put that into steam because heat would melt plastic, right? And then also on the other flip side is I cannot take a plastic paper pouch and put it into vPro or StairAd. Why? Because we know paper doesn't go into those machines. And the reason for that is because it absorbs the sterilant, which is the hydrogen peroxide. So if it absorbs the hydrogen peroxide, there's none left for the sterility concept to happen. So we want to make sure that we are paying attention to the material that we're using for the items we're processing. So spread them, right? So when we talk about making sure our instruments are open, which is great, they should be. Um, we also need to make sure that we are protecting the pouch itself from damage. And so in this case, right, somebody thought it was a good idea to spread these instruments way open to make sure that they stay open. And I get the concept. However, we're now compromising the integrity of the pouch. And you can see this actually wound up having a hole in the pouch because of the way that it was processed. And I will tell you, I would say maybe 7 out of the 10 times that I've ever pulled a pouch that was the instrument's positioned like this inside, there was a hole or some kind of damage to that pouch, to the seal or somewhere. So please, please make sure that you're properly putting these into a pouch. Use a tip protector, and we're going to talk about those, right? And then the other part to that too is this puts a lot of stress on your actual box lock for your instruments. So when we talk about tip protection, there are multiple out there. We talked kind of briefly about some. And so this is when we have failed protection, right? Like what happens when our protection fails. So we can see this instrument over on the left here. The instrument was put into this tip protector great as in an attempt to help protect it. However, the problem is the instrument is not open, right? So the tip protector actually is working the opposite and keeping it closed. The real tip protector that's needed is one that just showed up in the picture. It has basically a fold that folds up between the two shanks of the instrument. Okay, I call this a diaper. So I'm just gonna say because it reminds me of a diaper on a baby, right? Holding between the two legs. And anyway, so um and a tip protector with the diaper or the little flap to help hold it open is the best option for your hinged instruments like that. Then we have our plastic tip protector used, but it got separated, right? So you can imagine as it goes through the sterilization process, that blowing up and shrinking down concept, those tip protectors, those plastics can adhere to the other plastic. Sometimes it comes off, it slides off. And then also sometimes it comes off when transporting, like people are just, they got them in their hands and they're moving them around, the tip protector comes off. And then also, if you can see this, if you look at the ratchet part of this instrument, somebody put a tip protector on the ratchet of the instrument. And so very creative, right? Got to give him an A for the creativity. However, this actually wound up working the opposite because through the sterilization process, the metal stuck to that plastic and it worked the opposite and actually held the instrument in the closed position instead of in the like stopping it from closing like they intended. So just making sure, once again, utilizing the correct tip protector. And we want to make sure we actually have one, right? Because stuff like this happens. You can see the scissors poking through the plastic side of the pouch. And so really important that we protect the pouch. We're protecting the instrument itself. You're also protecting the instrument during transportation, like to the aseptic field, right? Sometimes those instruments get flipped or they have to be dropped. So if they have a tip protector, that actually helps protect them a little bit more. So let's go into sterilization. So sterilization setup. Let's talk about our setup here. You can see in these pictures, we have quite a few issues with our setup. So things that we have to keep in mind when we're talking about peel pouches and we're talking about loading our pouches onto our sterilizer rack. Our pouches should be standing on their edge. They should be facing paper to plastic, and all lined up, right? We should really be using our holders to hold our pouches in place and make sure that they stay lined up and standing on their edge. It's really important that they're standing on their edge so that the steam or the Sterling can drain out of the pouch. Laying them flat, like you see in that middle picture, especially laying them flat on top of the plastic part is a big no-no. So they should not be laid flat. Additionally, they should not be placed at the bottom of a shelf or underneath trays when you have mixed loads. When we have mixed loads, you always put your peel pouch on the top shelf. If you're doing a whole load of peel pouches, by all means, put them wherever they can fit. However, when you got a mixed load and you got trays involved, they need to be on the top highest shelf. So can't touch just okay, sorry, I won't do that. Touching a pouch when it's hot, you can contaminate the pouch, right? Or the package. So not this doesn't just go for peel pouches. This also goes for rigid containers because of your filters. It also goes for wrap trays. So you want to make sure that you're not touching these things when they are hot. So many times I see people like, they're tapping it. Oh, is this cool? Is this cool? Is this cool? No, this is why we have temperature guns. And when those guns are for a reason, right? Because your pouches and your wraps and your filters, they all have pores on them, just like your face, right? And so when it gets hot, those pores open up. When the package cools down to room temperature, those pores close and seal and create a nice sterile barrier. And if you keep touching it when it's warm, you're going to wick all the microorganisms you have on your hand. And I don't care how clean you think your hands are and how many times you licked your hands to make sure they were clean. If you touch it, your hands always have microorganisms on it. And if you touch it when it's warm, you are just going to allow those microorganisms from your hand to wick through and get inside the sterile package. Little. Can't touch this. Okay. So let's go to storage. We're going to talk about Storage Wars, SPD edition. Okay, sorry guys. I made this picture and I crack up. I crack myself up. Okay, anyway. Storage Wars SPD edition. So storage notes. So some of the things that we see a lot with peel pouches, and I don't know if it's like people feel like that it's a pouch and it's not as susceptible to damage as a tray or what it is, but I feel like pouches get abused so bad, and I feel so bad for these little guys. But things that you would never do with a sterile tray, people are doing with pouches, right? So mixed with non-sterile items in assembly. So you got pouches sitting on workstations, sterile pouches sitting on workstations, and mixed in with other stuff on your station. You got sterile and non-controlled areas. You got pouches like people's mailboxes on the wall, pouches, sterile peel pouches dropped inside their mailboxes for them to pick up later. That's a big no-no. We can't do that, right? We don't know what else is being put in there. So not secure, falling off the shelf. So I see this quite often. People put pouches just sitting on shelves, and so many times other people come by and they go to move that shelf or they bump it and all the pouches just fall on the floor. And I'm like, just get a bin. Just put it in a bin. So just making sure you're protecting your pouches. Okay, so some other issues that we see happening in our storage areas are stuff like items being stored in bins where the bins are not being dusted. We find dust and hair growing inside the bins, and the bins aren't being cleaned on a regular basis. As you can see in this picture here, which the pouch is not sealed correctly. And then we also additionally have dust being stuck to the corner of the pouches with a nice, lovely little hair growing out of the pouch. So once again, that seal not being sealed correctly, we don't know what is going inside that pouch as well. Additionally, we have items such as trays being stacked on top of peel pouches. These sensitive little guys are being crushed by trays. Wrap trays, rigid trays being put on top, the actual bins for peel pouches being put on top of individual little pouches. And these pouches will get holes in them from the pressure or the weight of the trays. They can also that can also damage the instrument themselves, and also possibly put a hole inside a wrapped tray if, depending on what type of instruments they're sitting on top of. So ensuring that when these things get put back after, maybe they're pulled for a case and are not used, and they're being put back in the correct position or correct place that's going to protect them from damage. We also have this lovely storage cabinet at the bottom picture here. And inside this storage cabinet, you can see we have multiple different situations happening. One, peel pouches, sterile peel pouches, and sterile items, period, are being stored with non sterile items. And so this creates a problem, right? Because we now have items being stored with non sterile. We don't know if they're being contaminated. Additionally, we have peel pouches being folded and shoved into bins or into different areas on top of trays and locations like that, not protecting these pouches in this manner, right? Like, this is not a way to protect the pouches. So avoid this. Don't store your pouches with non-sterile items, and definitely make sure that you're storing them, once again, in a protective manner. So that no hang zone. We see this happening quite often in facilities, and this is clearly an issue because people are running out of space, right? We've all been there. We've all experienced this. If you've worked in sterile processing, right? What happens? We say, "Hey, this is great news. We're going to start doing this new procedure. It's fantastic." And then we're like, okay, great. We now have to have, 20 new trays because we're going to be doing 10 of these procedures or whatever it may be. And wait, where are we storing these trays? Where are we storing these new instruments or these new items needed? So when new procedures are coming about, just ensuring that storage is being considered. And most of the time, that is not the case, right? We know that. And so what winds up happening, we have to get creative in the way we store things. Sometimes that creativity can be more damaging than helpful. And in this case, when we start hanging pouches, maybe punching holes in them and hanging them, or hanging them with little tabs on them, what we wind up doing is starting to put stress on those polymer chains that create your pouch. And we wind up starting to break down those polymer chains and weaken them. And that starts breaking down the integrity of your pouches. Additionally, you start the weight of those instruments hanging and pushing on the seal of your pouch can start breaking down your seal on your pouch, creating little micro creases or holes in them, making channels through them. So, and sometimes you may not see it or know. So when we're talking about storage and trying to figure out new solutions and get creative, just be careful that we're not getting too creative, right? And we're not causing more of a problem than we are solving the other problem. And additionally, punching holes in a pouch below your seal line is definitely a not recommended practice, right? Obviously, right here, this picture, you can see the hole is punched below your seal, and it's right there in your sterile um, area, which is supposed to be your sterile area, which now is no longer because we have a hole. So allowing microorganisms to get in. I've also seen clips, so clips with teeth being used to clip onto the pouch and hang it, which also causes holes and tears in the pouch. And once again, the hanging pressure. So, improper use of peel pouches, this is another situation that we see often when we go into facilities. We see pouches being utilized for things like like single items. People find something like maybe it belongs to vendors or belongs to a tray and nobody knows where it goes or what it is. And you put it in a pouch and you hang it on the wall or you hang it on your workstation and it's like, hey, does anybody know where this goes? Do I belong to you? Come claim me. But utilizing pouches for in this manner is not recommended. It's not validated like this. Your pouch is a containment device for sterility. So your pouch should only be used for containing items that are sterile. And utilizing them to hang stuff that is not sterile can cause confusion. Staff can come in and see something, it's in a pouch, maybe they assume that it's sterile, they don't see like that it's not been sterilized, they're not paying attention. Now, listen, would we hope that doesn't happen? And the chances of that happening are so small. Yes, we hope it doesn't happen, right? And it's a very tiny chance. However, it's still a chance. And our job in sterile processing is to protect that patient. And the way to do that is to remove any possible scenarios where stuff can be mixed up or mistaken or be um, or put us in a position or put anybody in that position to make that error. So making sure we're not utilizing pouches for stuff like that, utilizing pouches hanging from your pieces of equipment, like your sterilizers to hold load sheets, that we're not allowed to be using pouches for that in that manner either, or utilizing pouches in your extra instrument storage to separate instruments and to contain them. So all of these kind of things, there's other items out on the market that can help with your situations with storage. Utilizing a regular Ziploc baggie is even better situation than utilizing a pouch for this. And or baggies utilizing heavy duty bags for separating and storage, or they have those clear document holders to hang something from your equipment. Additionally, if you look at these pictures, the other situation we face is where everybody's using tape to hold everything onto their equipment and onto their workstations, and we wind up getting a buildup of adhesive. And in that buildup of adhesive, we just give microorganisms a nice place to grow and create communities and make homes and open businesses and everything else, right? So we don't want to even invite that or provide that situation. And the way to do that is not sticking tape or having adhesive on your workstations or work areas. The other situation we see peel pouches being used for a lot lately is holding your count sheets on the outside of your trays. So holding count sheets, there are items on the market that are made to hold your count sheets on the outside. Utilizing a peel pouch like this, folding it in half, and all of this, we just talked about pouches being folded in half and creasing it like this and the damage that it can cause to the pouch. So this is no different. This scenario is no different. Ensuring that your count sheets are, if you're going to put them on the outside of your tray, then they are put on the outside in a manner with a product that is made to do that. Or if you're going to put them on the inside of your tray, which nobody says you can't, but they need to be put into a bag so that you don't have ink transfer. And that's all we got for you today. I want to thank you guys so much for joining me on this uh, peel pack expedition, if you will. And I want to wish you all a great, happy CS week. And thank you all for what you do. You guys rock.